Welcome to the Episocial Hour, the show where we dive deep into the intersection of social issues, behavioral health, and the factors that shape our well-being. My name is Selena Ramirez, and today we have our graduate student, Erica Samano. We will be talking about complex topics, sharing personal stories, and providing practical tips for creating a more resilient and compassionate world. All right, so starting out here with Erica, can you tell us a little bit about yourself?
My name is Erica, and I am an MPH student here at the University of Texas at Arlington. My focus is on epidemiology, and my project today is on public health transport, and it's linked to public health.
All right, thank you so much, Erica. So, can you tell us a little bit about your background and what motivated you to explore the intersection of public transportation and public health in Fort Worth?
Yes, well, actually, I was just going through the news and I saw a New York Post about how Gen Z is driving less and they are asking for more public transportation.
Oh, very interesting. Okay. And what specific experiences or observations in Fort Worth prompted your research into transportation barriers?
So after I saw that post, I was looking into the public transportation system in Tarrant County. And I realized a lot of places do not have public transportation, such as Arlington. I live in Fort Worth, so I started looking at Fort Worth, and I realized Fort Worth only has 39 local buses.
Oh, wow.
With 2 regional lanes.
And do they have any train systems?
They only have 2. One of them can take you to Dallas, and the other one, I'm not sure. I think it goes to like Oklahoma.
Oh, wow.
What I also realized was that, like, after researching, 90% of the bus stops do not have a shelter. 78% don't have a bench, and 76% don't have a light.
Oh, wow. Yeah, that's really alarming.
No shelter, no lighting, the 60-minute.
That might definitely have something to do with it. It seems very unreliable.
Because 60 minutes, that's like, what, an hour?
Mm-hmm.
You have to wait at a bus stop before it comes to you for an hour before you can head to wherever it is that you need to head to.
Yeah, and especially people that rely on this public transportation to go to work, it also affects them economically. So I think that's a very important issue to bring up.
Yeah, and there's only like specific routes, so you have to go from one bus stop, take it to wherever it takes you, go to that bus stop, wait another 60 minutes. Mm-hmm. Like, when are you getting to your job?
Seems like you're better off calling out. All right. So how do you see public transportation functioning as a social determinant of health, particularly in urban settings like Fort Worth?
So public transportation is a significant social determinant of health, especially in urban settings like Fort Worth, because it directly influences access to essential resources, including healthcare, employment, and nutritious food. Inadequate transportation options can exacerbate health disparities by limiting opportunities for preventative care and healthy living.
Interesting. And what role do you think that public transportation plays in addressing chronic diseases such as hypertension, diabetes, and obesity in the communities that you studied?
Well, I believe it plays a crucial role in managing chronic diseases like these because you need reliable transit options to make it easier for individuals to attend medical appointments, access affordable and healthy food, and engage in physical activity. Like, for example, Texas Health Resources has a diabetes clinic where they teach people how to treat and deal with their diabetes. If you have a class that you need to attend, but you have no transportation to it, then you skip going and then you don't treat your diabetes. Or what if you have to go to the pharmacy to go get your insulin and you don't have transportation and it takes a bus 60 minutes? That's not good.
Yeah, no, agreed. And when it comes to data, can you explain your methodology for gathering data on transportation patterns and health outcomes?
So to gather data on transportation patterns and health outcomes, I combined geographical information system mapping such as Policy Map. I also used public health records and a survey that I made for the community.
Interesting. That's a very mixed methods approach. How do you believe expanding public transportation in Fort Worth could enhance overall community well-being?
Expanding public transportation could significantly enhance community well-being by improving access to healthcare, increasing job opportunities, and promoting active lifestyles. It could also help reduce social isolation of vulnerable groups, such as the elderly and low-income families who may currently feel disconnected due to transport limitations.
And as far as policy recommendations, how can local policymakers effectively prioritize investments in public transportation to address the needs of vulnerable populations?
They can do this by engaging the community members to understand their needs and using data-driven approaches to allocate resources efficiently, ensuring equity in decision-making processes, and collaborating with healthcare providers to create transit-friendly health hubs are also effective strategies.
You're engaging the community, but also
the healthcare providers,
other stakeholders. Yeah. You mentioned gaps in the existing literature regarding public transportation and health outcomes. What areas of future research do you believe are most crucial?
Future research could include examining the causal relationship between transportation access and health outcomes over time, exploring the effectiveness of various transit interventions, and identifying how transportation inequities impact specific populations, such as people with disability or the elderly.
And how can your findings be applied to other cities facing similar transportation and health challenges?
I believe my findings could be applied to other cities by using a similar data-driven approach to analyze transportation gaps and their health impact. Cities facing comparable challenges can benefit from understanding the links between transit access and chronic disease prevention and applying best practices for successful interventions.
And how do you think the issue of transportation as a public health resource fits into the broader conversation about health equity in the U.S.?
It's an integral part of the broader health equity conversation in the U.S. It can help reduce health disparities, promote economic stability, and ensure that all individuals, regardless of their socioeconomic status, have an opportunity to achieve good health.
Very great point. And in your opinion, what is the most important takeaway from your research for listeners who may not be familiar with these issues?
The most important takeaway is that public transportation is more than a convenience. It is a critical factor in achieving health equity. Addressing transportation barriers can lead to substantial improvements in health outcomes for marginalized communities.
Definitely agreed. Do you have any personal experience with the transportation system in Fort Worth?
I actually took it once when I was younger. My mom, it was in the summer and she didn't have a job and she can't drive. So I really wanted to go to the library, and so we had to cross like 4 streets to get to the bus stop.
Oh my God.
I'm not sure how long it took because I was a kid, but once we got to the bus stop, we got on the bus. I think we were like the only ones on it. Probably took like 15 minutes. Found out how to stop a bus. And then on our way back, we had an issue because the bus route, I guess it changed or something like in the afternoon.
Yeah.
So there was no way to go home. So we had to walk home.
Oh my God, that must have taken forever.
That took forever. And it was in the summer and I had all these books with me.
That's tough.
It was not fun.
Yeah, no, I can only imagine.
Yep. Have you had any?
So I actually used to ride the bus all the time whenever I was younger, but I lived in Dallas County. So with Dallas County, we do have the DART transportation system. So that one, I can definitely say there are definitely more stops. So, we wouldn't have to, like, for example, in your experience, walk over 3 or 4 streets in order for us to catch a bus. Some of them are covered. A majority of them are not, though. Some of them have benches. Majority don't. So that, I would say, is probably one of the most pressing issues whenever it comes to the DART system. But now that I don't live under the Dallas County, there is no kind of transportation. There are only like ride share, but of course a lot of people are not able to take ride share, don't know how to work the app.
And they're expensive.
They are expensive, yes. Like, why are you charging me $5 to go down the street? But yeah, so it's been a thing my whole life. So now that I don't have access to it, even though I don't even think I would use it, but just knowing that I don't have access to it is kind of like frustrating, I suppose. Like I never have a fallback option, I guess.
Why don't you think you'd use it? Is it dangerous?
I just wouldn't use it now, I guess, because I'm just so dependent on my car.
See, that's the thing. Yeah. I feel like if we had better transportation in Fort Worth, I don't think I would drive to work or like drive to school. I would just use the transportation. Really? Actually, yeah. I do have another story. So I was going to the Tarrant County Community College, and I don't remember if my car broke down or I ran out of gas. Typical. And I wanted to go home so bad, and there's a bus stop there. But I didn't know how buses worked, so I just got on the bus.
I think that's also an important issue that you mentioned. Like, a lot of people just don't know how to use it. So I think that would be a really neat thing to kind of look into for future direction too, is just like providing instructions.
Well, also, like, they probably do, and I haven't even looked at it, but they need to have like better ways of like communicating the bus routes. Mm-hmm. Like, do they have names?
The ones, like, for example, with the DART, they have numbers assigned to them. So I would always take the 11 bus because that's the one that took me to school. So what's the study design that you're using for your research?
So my study design is going to be a cross-sectional study to investigate the impact of public transportation access on healthcare utilization, physical activity, and chronic disease outcomes, specifically hypertension, diabetes, and obesity in low-income communities in Fort Worth. I'm thinking of collecting data for over a 6-month period from January 2025 to June 2025, allowing sufficient time for recruitment and data gathering.
Nice. And are you also taking race and ethnicity into consideration?
I wasn't thinking about that, actually. I guess that could be for, like, future research.
Yes, definitely.
I was more focused on the fact that, like, when I saw the map and, like, the big gaps I saw in the communities, that's kind of, like, what I focused on.
Like, the people that can use it more don't have access to it.
Yeah. It's like, okay, ridiculous. You have transportation, all these 35 buses go to downtown, but what's in downtown that we need? I don't even think they have a library downtown.
I guess we need to find out and get on that bus.
The courthouse, stockyards.
All right, now I know which bus to take. And what is your target population for your research study?
So I'm looking for adults aged 18 and older who are residents of low-income neighborhoods in Fort Worth. I'll be identifying their residents using census data or income threshold, and I'm specifically looking for participants who are able to provide informed consent and complete a survey in either English or Spanish.
Oh, okay, nice. Yeah. You should definitely be able to reach a broad population with that. So how do you plan to collect your survey responses from your participants?
So my survey will include questions on demographics, public transportation use, healthcare access, and physical activity levels. I'm also planning on using a questionnaire that I obtained from the American Academy of Family Physicians for the social determinants of health.
Oh, nice. Fantastic. Well, thank you so much, Erica, for joining us today. We truly appreciate the research that you're conducting towards investigating how transportation affects access to healthcare and overall chronic disease among low-income communities. So we thank you again, and thank you all for listening to our segment today. Again, my name is Selena Ramirez, and this was Episocial Hour.